Decisions made by politicians to travel over the holidays isn't sitting well with some of the people tasked with caring for those afflicted by COVID-19. Dr. Shazma Mithani is an emergency room doctor in Edmonton, where we reached her. Dr. Mithani, always good to have you on. Thank you for your time. Let's talk about this. As a medical professional on the front lines, when you hear about elected officials, of course, not just in Alberta, but other parties as well across this country, that are doing this despite public health guidelines, what do you think?
Oh, I have a lot of words. I'm extremely disappointed, frustrated, and frankly, I'm angry that this is happening and this has happened.
What message do you think it sends?
I think it sends a terrible message. I think it sets a very bad example of mistrust of this government. It also completely trivializes and dismisses the public health rules that my colleagues and I have fought so hard to get out there, that Dr. Hinshaw has put so much work and effort into putting together. And when people in positions of power are disregarding these rules and these suggestions and trying to bend the rules in their favor, it sets a terrible example to the rest of Albertans to follow those rules.
As politicians, they are in the public eye. As politicians, they're held accountable in perhaps a way that the average citizen isn't, to be sure. But do you think that these politicians are outliers in taking these trips, or that other Canadians that we don't know about because they're not elected are doing this as well, either not getting the message or presumably having an effect on the spread of COVID-19 as well?
You know, that's a great question, John. I can tell you that I don't know a single person in my friend circles and in my colleague and professional circles that has left the country over the holiday season. And so that's kind of the best way that I can answer that question, is that they do seem like outliers, because I really do believe that Albertans and most Canadians are trying to do the right thing and to try to follow the rules and the spirit of the rules.
Can I get you to talk a bit about the reality of the situations in the intensive care right now, in terms of the discussions you have with your colleagues as the cases continue to rise and as some public figures seem to continue to travel?
In talking with my colleagues in the last 24 hours, we're all very upset that this is happening. We are still fighting this battle in our emergency departments, in our ICUs, and in our hospitals. The case numbers may have settled down, but the hospitalizations and ICU admissions certainly haven't. People are still coming in very sick with COVID-19, and we are really starting to be profoundly affected by that in our healthcare system. All of our ICUs in the province are overflowing. They've taken over other parts of the hospital. Our COVID units are overflowing, and now our emergency departments are really having challenges getting patients in because the other units are full. And so we're all very frustrated to see this complete disregard for public health measures in the face of us fighting one of the hardest battles of our careers here.
This is a situation, as you talk about those numbers and those situations in the ICUs and the emergency rooms, that we have yet to see. Whatever mixing took place over the holidays has had an effect. We have yet to see perhaps the growth of case loads due to the variant. Can I get you to look into the future a bit and suggest where we might be headed with this in terms of what you deal with in your everyday work?
So we're already stressed in the situation that we have today, knowing that people likely did not follow the public health guidelines and gather during the holidays. Looking at how Boxing Day went in Alberta anyway, that there were multiple crowds at different malls in the province. I'm certain that there is going to be a spike in numbers as a result of the holiday gatherings. We saw this with Halloween, we saw this with Thanksgiving as well, and I'm certain we'll see this again with Christmas and New Year's. With the variant, as we know, it spreads much more readily, and there are already cases in Canada and in Alberta. And so I worry that with these gatherings and with the increased transmissibility of the new variant, that the cases are going to rise as well and continue to stress the healthcare system and unfortunately lead to more COVID-19 deaths.
Can I ask you why you got into medicine and how the memory of those initial motivations are being perhaps affected by what you're dealing with right now?
I got into medicine because it was something that I felt I could really make an impact with. I have seen over the last several years of my career that that the work that I do in medicine does have impacts on the patients that I see. Even if it's just one patient that I can help a day, that's enough for me. It's frustrating to see during this pandemic the bending of the rules and the direct effect on the patients that I see with that disregard of the rules. I am seeing people dying. I'm seeing family members not able to see their ailing loved ones in hospital because of these public health restrictions. And then to see that people in positions of power are skirting around those rules in order to spend time with their family is really a slap in the face.
Dr. Mithani, I want to thank you for your candor, and I want to thank you for your time and for the work that you do every day. Thank you so much, and all the best wishes for the year ahead.
Thanks so much, John.
Dr. Shazma Mithani is an emergency room doctor in Edmonton, and that's where we reached her.